Hey y'all, how are you? It's almost Monday morning, so I would like to say motivational Monday. Um, but I don't know if I have any motivation to give you other than to pray, 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 pray. Because this is crazy, this news right here. So I'm gonna be quick and to the point. Let me share it with you right here. Sorry, I'm not on screen, but it's been a very long day. I went to church today. I enjoyed my service. I had to come back home because my daughter needed to go to the urgent care because she is sick and she has a upper respiratory infection. So I am quarantining myself in my room right now because I can't afford to get sick before my surgery. Now, just want to get that out of the way. Thank you for watching. Please hit the like, hit the hype, share my videos out. Your girl needs all the help that she can get when it comes to views because they're just not giving them to me. I guess they don't want me doing any of the things that I'm doing right now. Pretty soon I won't be able to do that because they're going to take all this stuff away from us. So get the news while you can. So what's going on right now is the WHO has declared a global health emergency, Ebola outbreak. Yes, we have Ebola outbreak many times throughout the years, but apparently this one is worse than the others. And I'm going to show you videos as well. So it says the Ebola outbreak declared well, they wrote that wrong. The WHO declared Ebola outbreak a global health emergency. The World Health Organization has declared this in Congo and Uganda a public health emergency of international concern after officials identified more than 250 suspected cases and 80 suspected deaths. Actually, the deaths have gone up to 88 as a few hours ago. So let's see what he's talking about.
Public Health Emergency Operations Center strengthen epidemiological
virus in 2 African countries have prompted the World Health.
Here we go.
Tonight, outbreaks of the deadly Ebola virus in 2 African countries have prompted the World Health Organization to declare a global health emergency. CBS's Imtiaz Tayeb of our London bureau reports on the efforts to contain it. Imtiaz.
Jarika, good evening. There's a major push to contain this fast-moving and deadly outbreak of the Ebola virus. The Democratic Republic of Congo's government has said it's activated a public health emergency operations center, strengthened epidemiological and laboratory surveillance, and ordered the rapid deployment of response teams in an attempt to contain the outbreak. This remote corner of eastern Congo is on edge. In a nearby gold mining area, Ebola is spreading fast and people are dying. John Kasembo is a motorcycle taxi driver. We are very afraid, he says. Since the beginning of May, many people have died, and it keeps happening. We're so scared. Kasembo is right to be afraid. Spread through direct contact with bodily fluids and through broken skin, Ebola causes severe bleeding and organ failure. There is no proven cure for the virus, and according to the World Health Organization, the average fatality rate is around 50%. CBS News medical correspondent Dr. Celine Gounder says containing the virus won't be easy.
It's already a big outbreak at the point that we're hearing about it. There have already been a number of deaths, and this is a strain of Ebola for which we have no treatment, no vaccines.
This is the Democratic Republic of
That's very convenient.
Congo's 17th outbreak of the deadly viral disease, which was first discovered in 1976 in what is now the DRC and is thought to have spread from bats. It's also unfolding against the backdrop of a deepening security crisis in the region, where clashes between rival militia groups have killed dozens of civilians in recent weeks. And tonight, global health experts are warning the Trump administration's dismantling of USAID and withdrawal from the WHO may have a serious impact on the global effort to contain the virus, Jarika, an Ebola outbreak which has already claimed dozens of lives.
And we won't get information that's up to date. We'll get it second or third hand because we're not a part of the WHO. So let that sink in there. Once again, another virus. And I feel like they have the cure to a lot of things, but they don't want to share the cure for a lot of things, because how can my friends get richer if I share the antidote for this stuff? Just saying. So here is the person who runs the WHO.
The new Minister Roger Kamba, concerning the new outbreak of Ebola disease in the country's northeastern Ituri province. Currently, WHO is aware that 13 cases of Ebola have been confirmed by INRB in Kinshasa. And on the 5th of May, WHO received a signal of suspected cases and sent a team to Ituri to support DRC health officials in their investigation of the outbreak and collect samples in the field, which initially tested negative for Ebola. Samples were subsequently sent to INRB, which yesterday confirmed some as positive for Ebola. This is the 17th recorded Ebola outbreak in DRC since the virus was first identified in 1976. DRC has a strong track record in Ebola response and control. I have also assured the minister of our full support. The World Health Organization's representative to DRC and other WHO experts are in Ituri and working side by side with DRC health authorities to respond to and contain the outbreak. Additional WHO experts in risk communication and community engagement, infection prevention and control, clinical care and logistics will join the WHO team already on the ground in coming days. We have deployed medical supplies and protective equipment for infection prevention and control to Bunia, the Ituri provincial capital. Today, I have released $500,000 from WHO's contingency fund for emergencies to immediately support the response. Priority actions include risk communication and community engagement, strengthening disease surveillance, active case finding and contact tracing, infection prevention and control in health facilities, expanding access to safe clinical care, and increasing laboratory testing capacity. WHO will continue working to support the Democratic Republic.
Yeah, we're going to stop that right there and move on over to the next thing, because I just feel like they be playing around and playing in our face and releasing things. They're not going to stop till they have a number of things out there so they can up the number of people, the billions of people that they want to get rid of. And the only thing that keeps coming to my mind is listening to this man say what he said that they do to children in Africa.
We're taking things that are, genetically modified organisms, and we're injecting them in little kids' arms. We just shoot them right into the vein. We're taking things that are,
genetically modified organisms, and
we're injecting them in little kids' arms. We just shoot them right into the vein.
Yeah, that doesn't sound bad at all. Makes me want to stand right in line and roll up my sleeve.
I know, right?
We're taking things, we're taking things that are...
Bill Gates once stated that we need to reduce population by 3 billion people. To directly quote him, he said, if we do a really great job on new vaccines, healthcare, reproductive services, we could lower that number, because he was talking about how we're about to be at 9 billion and that's too much. Now, mind you, he has his hands in vaccines. He is one of the biggest landowners in America, like farmland in America, at over 275,000 acres of land, farmland. With this, he also bought out Bragg's apple cider vinegar, which was known to be one of the healthiest apple cider vinegars. And he's using the apples that he's coating with a waxy coat called a peel. That's also on your organic fruits. It's got asbestos all over it. So there's that. He also owns half of the potatoes that McDonald's uses for their French fries. And don't get me started on bioengineered food. Because he's a huge backer on that. Between 2022 and 2023, he donated $830 million to WHO and stated, "We must make vaccines a high priority in your health systems to ensure that all your children have access to existing vaccines." He also stated, "We believe unbelievable progress can be made, both inventing new vaccines and making sure that they get out to all the children who need them, and the benefits there in terms of reducing sickness, reducing the population growth. It really allows society a chance." He was listed in the Epstein files, just so you know. Bill Gates once stated that we need to reduce population.
So there's that. And then there is this. Yeah, they're playing in our faces. RD, they really are. And it's not just Bill Gates, it's all of them. But he just always the top one.
To reduce population growth is actually improve health. Now, that's the only thing that really counts. This is a bit scary. We go from less than 1 billion in 1800, and then 3, 4, 5, 6, and 7.4 billion where we are today is happening even faster. Nigeria is headed to be the 3rd largest country in the world, 800 million by the end of the century. So actually China will have shrunk by then. Is the population going to get so big that feeding everybody and maintaining the environment is going to be impossible. Particularly as
this is why they're doing the things that they're doing.
People get richer, they tend to eat more meat. If we don't do anything, this sector will actually grow over time.
So you're saying not just the fact that there's more people and a larger population, but as people move up towards the middle class, they want to consume more meat.
The one that has gone better than I would have expected 5.
So how dare people who are middle class decide they can now afford meat because they couldn't afford it before. They want to buy meat for their home, for their families. Now the wealthy people like him, they're saying, well, they're going to consume too much meat. So we got to do something about that. The audacity.
Years ago, is this work to make what's called artificial meat?
You eat it as well, and you like it?
Absolutely.
So All Things Bugs is my biotechnology company that I founded in 2011. Primarily, it got.
Oh, and it's not just us, the people. They also, you know, they want to limit how much meat we intake, like real meat we get every week. But they also want your dogs and stuff, your pets. They don't want your pets to be eating meat because, you know, a lot of people feed their pets, you know, real food instead of that dog food stuff. They don't want that either. So the carbon input and output, they're watching. This is why they want to connect everything to these digital data centers so they'll know how you're buying, what you're purchasing, you know, to see what you're getting. And then that's when they're going to come in and throw limits out there. Limit on this, limit on that. Nope, you can't have that. Too much water for you this week.
Started to develop a food product for malnourished children using insects as a major food source.
This is a powder derived from the mealworm, and it's a insect protein just been approved by the EU.
Didn't I tell y'all last year, the year before, and this year that when they get this stuff together, they're going to get influencers who don't mind being paid off. I will not be one of them. I don't care how broke I am. I will not ever tell y'all to do that. If I ever come out and tell y'all to do that, to know that I have been replaced by somebody or something. This is Robert Downey Jr. And it's okay if people want to consume that, but why are you trying to force people to do that? But yet they'll still be eating their filet mignon.
for human consumption.
I am here to reveal my hidden talent, eating micro livestock, cornworms. They're still alive.
Another actress.
Extraordinary.
Bill Gates is on a crusade against meats. He wants you to eat plant-based meat, lab-grown meat, and now he even wants you to eat literal bugs.
And mind you, this man has stock in so many different companies. Coca-Cola, like they just said earlier, McDonald's, which my daughter works at a McDonald's. Half the people work at McDonald's don't even eat McDonald's. So, yeah.
A lot of populations in the world shrinking right now.
They are. There's a really interesting book called The Next 100 Years. The most interesting things he wrote, the rate that the population is growing is decreasing. Unless something weird happens, we're going to cap around 2050, and then the population is going to start decreasing on the planet.
On the planet?
On the planet. He says planet-wide, the rate of population growth is decreasing. He gives a lot of reasons for it. We all started as agrarian nations, and in an agrarian nation, the more people you have, the more money you can make because more people can work the fields. Once we became more of an industrial nation, having more kids does not get you more money, it gives you more expense. But because of that, family sizes have gotten smaller and smaller over the years. And we see a lot of people now with one child. Well, there's two of you, so you need two just to break even, three if you want the population to grow.
A lot of populations in the world shrinking right now.
They're machines. They hunt us, but they don't eat us. They don't sleep. They don't breathe. They don't go an inch above 8,000 feet. It's not a living creature. That's programming. By who?
Anyway, I'm getting deep into some other stuff now. I don't want to do that. So yeah, I just wanted to let y'all know that the WHO has come out and declared a public health emergency, a global public health emergency of Ebola. So something else to add to the list. What do we have now? Hantavirus. We have a norovirus that's also going around. Nobody's really talking about that, but I heard about it. And now Ebola has actually been labeled a global health emergency. So y'all take care, stay safe. Watch yourself when you're out there, when you're shopping and stuff like that. Make sure you're washing your hands often. Maybe using some nasal spray that has the iodine in it. That's what I've been using. I bought my whole family their own bottle, but apparently my daughter has not been using hers, and now she is sick. I'm not sick yet, knock wood, and I pray that I don't get there. But they gave her antibiotics, and hopefully, you know, she'll be okay. They told her it is contagious. I'm like, oh, great. I'm like, she was sneezing in the car on the way to the doctor today. And I mean, just back to back, chew, 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 chew. I'm like, oh my gosh, where is your mask? Just for small spaces, just throw a mask on. And so I gave her one. I gave her my mask. I had an extra one, but I'm like, yeah, spraying everything down and whatnot. But I've been in my room. I text her, see if she's okay. I put a mask on just to go out there because I can't afford to get sick, because I really do need my surgery in another week from now. But yeah, y'all take care and just stay safe. I don't know if she got it from working at McDonald's, with all the weird people that come in there, or she could have got it when she went to the gym. We both went to the gym on Monday, and then she went to the gym on Wednesday or Thursday, one of the two. She went to the gym. I didn't go. I stayed. I just didn't feel comfortable going in there on Monday. I was like, there's too many people in here, and I know too much stuff that's going on out here, and I know people don't like to wash their hands, even though they're spraying the machines down in between. And I just felt icky in there, and I was like, if you want to go, I'll take you, but I'm not going to go in with you. and now she's sick. So yeah. Psalms 91. Okay, thank you, Sasha. Y'all take care. If the WHO, yeah. The WHO is, oh, should I say it? The WHO is being, they receive money from Bill and Melinda Gates. I'll just say it like that. Bill and Melinda Gates donate millions of dollars to a lot of different companies that create a lot of different things that is going on now. But I'll have those videos for y'all. I'm gonna do them as shorts though this week, just so y'all can see the crazy stuff that's going on out here. But if you stay prayed up, you ain't got to worry about it. We'll be okay. But you still should be informed about it. What'd you say? Yeah, it is. And honestly, it's set up of a lot of elites, if you ask me. Like, yeah, you have the countries that's in there, but who's actually running it is really the elites. It's people, they get information from like Charles Schwab and these other people. Anybody that donates a lot of money is going to have a say. And seeing how we, the little people, don't have money to donate to them, they're not caring about what we feel. You see how people go in and protest over the data centers, you know, and people getting their homes taken and land being used up and all this other stuff, water being drained. They don't have water coming out their faucets. That's all intentional. And they don't care. They don't care that you voted for them and voted them in, because if you ask me, they're getting money on the back end, allegedly. I don't know this for sure, but somebody's being greased, because all of a sudden nobody cares about what anybody say. Nobody cares that there's election coming. Usually, you know, they try to kiss your butt to get your vote, but they're like, I don't care. That should make all of us concerned. The fact that they don't care. Like, it's not going to affect them and their family, because they're not making, most of them on the local city level, those people aren't making money like the big people in Washington. But they going along with it is going to affect them as well. I mean, how dumb. But anyway, I don't want to rant. It's late and I couldn't sleep, and I got on here to do something else, and I saw that and I was like, oh my gosh, I'm gonna go ahead and do this video now. So yeah. No, we don't have friends. Mom used to always tell me, my mom always told me, girl, you ain't got no friends. You have associates. They're not even our associates. I wouldn't want to sit and have a conversation with them. And they definitely wouldn't want to sit and have a conversation with us. Because if they did, then they would get the feedback that we don't want half the stuff that they're doing. So they figure they're going to play God, and they're going to force feed us all the stuff that they want to give us. It is what it is. At this point, you know, I hear people saying, well, you know, we need to stick together and we need to protest. Yeah, it would be great if we could stick together. But even in sticking together, these people don't care. We just need to keep it real. They do not care. They have an agenda, and they have to have everything in place. This is why it's just such a rush. It seems like everything's being thrown at us right now. These things have been in the works for years. But now that the technology is there, they see that they can really get there faster than 2030. 2030 is still the goal. You got to set a goal. You know, these are wealthy people. They set a goal. But we're going to get there before 2030. If in 2027, they're telling people in, was it Lake Tahoe I told y'all about, that they're going to kick them off of their utilities. Like, oops, I'm sorry, you can't get electricity anymore because we need to give it all to these billion with a B dollar companies. You need to find another source of electricity, another company or something. I don't even know how that works, because when you live in a certain area, you have to use a certain company. So how, if I'm living where I'm living, I can't just go and switch from Energy United or whatever and go over to Duke or whoever. It doesn't work like that, to my knowledge. But these people, they're not going to have electricity. Oh, well. Pretty soon, we're not going to have water. The water we get is going to be so expensive. The water and electricity is going to be so expensive. You are literally going to be standing in the store, if you get to walk in the store, and go, okay, let me see if I can make some arrangements. Your water and your electric bill. Some people electric bill right now is more than their car note. That's crazy. But anywho, y'all have a blessed night, and I'll see y'all tomorrow. Turn your notifications on. Please hit the like button, hit the hype button, help this video get out to more people, and all of my other videos as well. Judgment on America, nothing happens unless the Most High allows it, as Job, even Satan has. Yeah, of course. That's true. Nothing happens without the permission. God will use everything that they do, that they have set for wrong. He will use it for the good. And we're going to have to be taught a lesson, whether we had anything to do with it or not. Is it MKB? Because Texas, some part of Texas, I can't remember, is it San Antonio? They're having somewhat the same issue too, where they're taking a lot of the power and sending it to, because Texas has a number of data centers there, sending it to those data centers. But Texas does not have as many as Virginia. I think Virginia is leading everybody right now with how many they have. And now they've come up with the mini data centers that attach to your house. But mind you, if your house burned down, your insurance is not going to pay for it. Like if that thing goes awry and it catches a fire and your house catch fire, it's not going to pay for anything. Your homeowner's insurance is not going to pay for it, because that's not a part of your home. Oh, y'all can choose y'all provider, but it can't in Texas. Well, I guess that's a good thing. I don't know if Lake Tahoe is like that or not. I know I lived in a place, and in Sumter, South Carolina one time, and you can do prepaid electricity. I had no idea. Like if you didn't have your down payment, you can just be like, okay, well, I'll just do prepaid. I did prepaid lights. I kind of liked it because it kept me on track of how much I was actually using. I could adjust, what I'm doing. Like, oh, don't do that anymore. That's taking up too much electricity. But yeah, I don't know what they're going to do. But what they are doing is whatever they want to. When I lived in Georgia, there was only Georgia Power. Yeah. I think it was like that in South Carolina, in Columbia, South Carolina. I think at one point it was, I don't know if it's still SCENG. I don't live there anymore, but it was SCENG. And I think that was the only one in Columbia. But, of course, if you went to another city in South Carolina, even if it wasn't that far away, it might have been another company. But I don't know if they cross lines like that or not. So I feel for those.
I didn't get that. Could you try again?
Y'all hear that? My phone is listening to me. Did y'all hear that? She said, I didn't get that. I didn't even touch my phone. My phone's sitting on the thing. It's literally sitting on the desk. And she said, I didn't get that. Oh, you got it. You listening to every word I say. They listening to every word we say on our TV, on our phone, on our computer. It's sad. It's sad what we're turning into. We've been taught a lesson now and commenting. Who looking to the creative first choose. My daughter is not feeling well, MKB. I'm doing fine, thank God. Hey Ann. Hey Miss Ann, what you doing? Up so early? So early. Yeah, I guess so early. What is my time is 12:31. She done got some kind of upper respiratory infection. I took her to the doctor's care or whatever you call the place, urgent care. They say it's contagious. I told her stay in her room. She come out, put a mask on or something. And she was doing fine. She was just complaining yesterday after I picked up from work. But she thought she had allergic reaction because she's allergic to nuts. But she didn't eat any nuts. She said she ate an apple when she was home. So she figured it was the skin of the apple, even though she had washed it. But then she ate some apples from McDonald's. And she said her throat just started like itching and hurting and felt like it was going to close up. And she was like, I'm not allergic to apples. I said, girl, I don't know. You ate a McDonald's apple? Y'all heard what I just played for y'all about the Bill Gates and the apples and the other fruits he got. So they're giving us allergies to things at this point. But they said it was contagious, so I'm checking on her from afar. Hey, Sasha, welcome in. It is a lot in the air, so I don't know if she got it from work which is at McDonald's, which is so many weird people be going in there when I be sitting out there waiting on her to come out. I'm like, ugh. And then she went to the gym. So who knows where she got it from? But I know I took me a shot of vitamin C and some, what's that? Emergency, that stuff. I put some of that in some orange juice and took it like a small shot glass when I got home, and used my Nasamine, which she should have been using her Nasamine, but you know, I don't even know if any of my family using the Nasamine that I bought them. But hey, all I can do is give it to you. What they say, you can lead a horse to water, but you can't make them drink. But I know I use my Nasamine every day. If I know that if I'm leaving my house, I'm going to use my Nasamine. And especially if I got to go to the store or whatever, which I do need to do a couple of store walkthroughs this week, but I don't know if I'll get around to it or not. You're like, what? What is that, a peach? I don't have my glasses on. I don't know. So if you were just coming in, we were talking about the WHO coming out and declaring a global public health emergency, that of Ebola. And there is no cure for Ebola. And it's already taken the lives of about 80. They said 80, but the other report that I saw that I didn't show y'all, it said 88. And they think they're trying to contain it, but they feel like it's going to be international. How do you feel that it's going to be international, though? I don't know how that works. But anywho, if you feel it's going to be international, then maybe you should close a border or something. I'm just saying. Hey, Bonnie. I guess I should share that one. I don't know where I put it. That ain't it. I was about to go down a rabbit hole looking at that other stuff. Okay, here it is. I'll show the other one. Okay, I don't want to show that one. I already showed that one to y'all. I'm going to show this and then I'm going to end. I said I was going to end, so I need to go ahead and end it because it's late. Late or early, depending on where you are.
We have serious news this morning. The World Health Organization has declared the Ebola outbreak in Africa a global health emergency. Here's what you need to know, and here's what that means. As of this post, there are 88 deaths and over 300 suspected cases of a deadly Ebola virus strain that currently has no treatment or cure. The World Health Organization made clear that this outbreak does not meet pandemic standards and has advised against the closure of international borders. The World Health Organization declaring this a global health emergency is designed to spur donors and countries into taking action to prevent the spread and to stop this from getting any bigger. There is serious concern that this could become a bigger outbreak from.
So I'm confused. I hadn't listened to his whole video, but I'm confused now. So the WHO is saying that it probably won't become a pandemic, and then they say they don't feel that you should close the borders, but then they say what?
And to stop this from getting any, designed to spur donors and countries into taking action. Should make clear that this outbreak does not meet pandemic standards and has advised against the closure of international borders. The World Health Organization declaring this a global health emergency is designed to spur donors and countries into taking action to prevent the spread and to stop this from getting any bigger. There is serious concern that this could become a bigger outbreak from doctors across the internet, especially as the world's leading country in Ebola responsiveness, the United States, gutted USAID and withdrew from the World Health Organization. At this time, I want to make clear again, there's no threat to the public here in the United States of America, but it is a very serious threat to those in Africa, and communities are really being devastated right now. I'll have more updates for you.
That don't even make sense to me. It's not a threat to us, but you're not closing the border. So people are going in and out of Africa, and we shouldn't be concerned that somebody from over there is going to come over here like they did with the C-19. I mean, the C-19 didn't start over here. It started in China. And it went what? International. Oh, these people be talking outside of their neck. Mm-hmm. Okay, well, I'll talk to y'all later. So I don't do Bible debates because that's just, for me, I look at that as confusion, distraction, takes you away from what you should be focused on, which is Abba. So, yeah. I don't do debates and stuff. I don't want y'all to be debating and stuff. I want y'all to keep your focus because it's a lot of things that's designed to distract us from everything that's going on. And whether things are missing from the Bible or still in the Bible, it should all be about the Word of God, which is love. But with everything that's going on right now, I'm waiting for him to come and show some wrath. I'm just saying. Because these people need to be put in a place. They need to be put in a place. But that's not for me to make that decision. But he sees all. He knows all. And like who said before? I can't remember who said it before. There's nothing that's being done that he don't know about, that he's not allowing to happen. So let's just stay prayed up and stick together, because these elites are sticking together. We don't need to be arguing amongst ourselves, because that's what they want us to do, which is why they have set in place, like I told y'all yesterday in the other video about the water restrictions and them answering the question of, well, how will they know if somebody's overstepping and using too much water? And their response was, we're counting on the community to report it. So they want, just like in China, where, you know, you get points on your social score if you report, you know, good deeds and bad deeds, good deeds and things that people do that's wrong. You get scored higher while that person gets scored lower. They want you to then snitch on your neighbors, basically. Hey, you know, they're using water over there. They shouldn't be using water over there. And we allow them to use us like that. They ain't telling on each other. You think this elite over here is telling on that elite over there? No. But they'll put things in play to keep us against each other. So we're not focusing on them. Everything is being done to us by them. So we need to be focusing on one, God, but we need to be focusing also on what they are doing, not going at each other. But anyway, y'all take care. I'll see y'all tomorrow. Well, later today.